Welcome to the Long-Term Care Chronicles podcast.
Thank you so much, MPP Armstrong, for coming on to the Long-Term Care Chronicles. And we'll start with the first question here that we have in terms of with Bill 13. It looks at the three important parameters to establish the minimum standard of care for each resident. Would you be able to go over each parameter for our listeners?
Yes, thank you. And I just want to say hello to everyone out there in the virtual world and the Zoom world. Thanks for having us and for bringing, long-term care in a different platform, where people can access some of this information. So I do appreciate you inviting me on the show. So with Bill 13, it requires that every long-term care resident has a plan that includes a minimum of 4 hours of direct care per day. This is just a minimum, and an average of care can be prescribed by regulation. So this is what the bill does. So specifically, the legislation reads that the licensee shall ensure that the care set out in the plan of care is based on an assessment of the resident, and the needs and preferences of that resident are taken into account, that the licensee, and that's the duties licensee to comply with subsection 8. And subsection 8 of the Long-Term Care Act is very clear. And basically it says that, and I'm going to read it here, it says, where the act or this regulation requires a licensee of a long-term care home to have, institute, or otherwise put in place any plan, policy, protocol, procedure, strategy, or system, the licensee is required to ensure that the plan, policy, protocol, procedure, strategy, system is in compliance with and implemented according with all the applicable requirements under the Act. So that basically is saying that when there's a policy, like for instance, if Time to Care bill was to be legislated and passed, that the licensee is required to implement that according to subsection 8. So that's where the bill is laying out those parameters and saying, under that subsection 8, that licensees are all required to, just go over that and basically implement what has been legislated with regards to a plan, a protocol, a procedure, a strategy. They have to implement that. And that's why it's so important that we legislate the 4.1 hours of care, because otherwise it's very difficult to hold homes accountable.
No, thank you for that. And as well, with the individual determining this level of care, will that come from the case mix index? Will this be used for Bill 13 to determine the resident care worked hours?
So there are 4 envelopes of funding in long-term care, and only the direct time would be included in our calculations. It would not include hours paid in respect to vacation or statutory holidays or leaves of absence or sick time or training time or for any other purpose which don't involve direct care. So we want to make sure that what we're calculating is specifically direct hands-on care. And the bill doesn't change the way the level of care funding is determined. Which, as you mentioned, it would be based on the case mix index. And the bill sets out, again, a minimum amount of care that the resident should receive. And the data is complex when you're looking at a case mix index, because every resident is very unique, right? And over the years, as we know, there's been a lot of people are living longer, which is a wonderful thing, but then there are more complex needs. And there's also cognitive issues and, Alzheimer's and dementia. So, when the bill's in committee, I'd love it to be called out of committee and get those deputations and to hear from experts how this data collection would impact in the case mix index and how we can deliver that. Yeah.
So then this will help in terms of the minimum standard of care to determine, is that correct?
Absolutely, because the case mix index is all about a plan of care, and that determines, the hours of level of care. And so hearing from experts how we can apply and what we need to do to ensure that those pieces are included is something that we should be doing when we're talking about legislation. We need to hear from the experts. We need to hear from frontline workers, because even, what the experts say, the frontline workers are doing the, practical work. And we need to understand the barriers and how we can solve those to get to that 4.1 hours. RNO did a study on it. And that's part where, again, we get this 4 hours of care. And even in that assessment, I believe they said that the majority of that 4 hours that they assessed, the PSWs had the biggest chunk, which is the primary care on the front lines, where, you're getting people ready, the basic needs, right? I shouldn't say primary care, so the basic needs of the resident. And those residents are precious and treasured, grandparents, our grandmother and our grandfather, obviously our loved ones, our extended family and friends. And I just think they deserve so much better over the decades where successive governments have just failed and they've promised. It's been far too long neglected to make these changes, and we just can't wait anymore.
I couldn't agree more with that. And in regards to what you mentioned before, the 4 envelopes in terms of where funding comes from for long-term care, in this case, with the case mix index, which of the 4 envelopes is it being drawn from?
Yeah, so you've got your, the first envelope is your nursing and personal care. Then you got program and support services, and you have other accommodations and raw food. So it would be the same envelope. It wouldn't change. It would be from the nursing and personal care. So the current estimates say that the province provides funding that offers residents right now. They have an average of 2.7 hours of direct care per day. So we know that that's not enough. We've had studies for a few years now. So what that means is that because there's no minimum standard of care, homes are not obligated to hire enough staff to provide quality care. So what we want is this legislation to be enshrined, so that there is a minimum requirement, and they would have to provide that according to the law. And so what would happen is that then they would have to have enough staff to provide that resident in-home care for no less than 4.1 hours of direct care per day. So this is a way to get there, right? To understand, what the staffing needs are once we implement 4.1 hours of care. That will organically tell us, how much staff we need, and holds homes accountable to do that.
Yeah, that's great. And then with Bill 13, and it supports the minimum standard of care for each resident. However, if, let's say, a facility requires more because they have a different mix of population, let's say it's less seniors and more younger folks that are more medically complex. So how will that be supported by the government, and what would they be able to do to ensure the monitoring of this new minimum for this? But let's say it's 1 or 2 facilities that require more than 4 hours of care.
So as we said with regards to the care, so currently the policy states that the case mix index only impacts the nursing and personal care envelopes. So what we're saying, the bill also creates a regulatory authority to allow for higher prescribed amounts of minimum hours, right? So we know that 4.1 hours is an industry standard that many experts could have said very well, that was a few years ago. So that's why we say, like, it could be outdated right now because the acuity of the level of long-term care residents continues to increase year after year. So that's why we're saying it's a prescribed minimum amount of hours. So it can be adjusted if it needs to be. And the purpose of the bill, again, is to create, I keep saying that, but really it's to create the minimum that average right now is 2.75. That is not enough, we know. So we need to up those standards and legislate that. And it's clear that we just can't rely on promises. As I said, successive governments says, yeah, we're going to do something, we're going to look at it, and it doesn't happen. So we need to make that guidance in order for it to actually come to fruition. So Bill 13 is just really, again, one of the pieces of foundational changes that we need to overhaul the system. And we have called for greater transparency, as you know, as the NDP, and accountability in long-term care sector. And so every public dollar we believe, again, should not be in a for-profit healthcare system. It should be, all money should be accounted for. And so if this bill passes, and I want it to pass so badly because it's needed, then we can expect that we should be reflected that financial reporting in that long-term care homes and how to provide that, right? So it's very, very important that there is a accountability piece and transparency piece attached to it. And one of the ways we get there is by taking profit out of care. And if say we have that scenario continue to happen, then we have that built into the regulatory process where there's that financial reporting in this bill.
Well, that's great those are one of the safeguards in terms of the reporting, so that has it. And with Bill 13, do you think that this will support people in the profession to prevent them from leaving at this time?
So what I have heard over the years, workers have been very, very strong voices in what's been going wrong in long-term care. And as I've heard from especially PSWs, right? Because they are the front line. And if you think about the long-term care home, it is a home, but the way the structure, the infrastructure, it doesn't feel like a home, and the workers can't do the job that they want to do, with the resources that they have. So if we, create the 4 hours of care, the people that are there now, I think are going to have a big sigh of relief that now I can come to work and I can actually not have to, prioritize or triage call bells. Or if I'm in the middle of helping, somebody being toileted and there's 3 call bells going, how stressful would that be for you, right? So I think that it would be very helpful, and it would also give people recognition and acknowledgement that their work is valued, and you're not expected to rush somebody out the door in 6 minutes. And that was a 6-minute challenge that Unifor said that they're allotted to get a resident ready, and out the door. So on a worker's side of it, how would you feel if you have to treat somebody like that? On the resident side of it, how would you interpret the way the care is being delivered to you? And from a family perspective, because over the years we've heard from families, they were very vocal, and they were very supportive of workers and saying, it's not the workers' fault. They don't have enough of them. And it's absolutely true. So we need the workforce to be there, and we need the 4 hours of care. And that's just one step in order to make sure that these working conditions are safe and healthy for everyone to deliver the job and for the residents to receive that care. But also in the long run, we need to look at long-term care and how important it is. We have the most vulnerable population next to children that we're looking after. And here we are just, saying it's good enough. During the pandemic, everybody saw what the Canadian Armed Forces report revealed, but we already knew those things were going on. And so that is where it's so disheartening. And we need to legislate things, because we can't just leave it up to people's good intentions to say, oh yeah, I'll give that average of 4 hours of care, sure. And that's what the government's proposing. In 2025, no one can wait till then. Seniors, people in long-term care, loved ones are suffering now, and workers without the right resources to deliver that care.
Yeah, this would be very vital for them to be able to have this. And as well, how do you envision a minimum standard of care would apply to each resident in the future? Because right now, would there be daily showers versus the current 2 showers per week? And oral care and hand hygiene and hearing aid can be included in the minimum standard of care as well?
How I envision it, there's necessities that, like you say, we need to hire more staff, and we've been hearing from experts, hearing about staff being run off their feet, and that they, that they end their shifts and really they're in tears when they're done. It's true stories, So by doing this would allow them to actually take the time for the residents. And you have to remember that they have developed a relationship with people that they care for. Very, very close. It's like their extended family. I've heard from many workers, and and the residents rely on those workers as social contact, and workers have very very, very high level people skills, right? And it's not something that is valued in long-term care. It takes a special person to do that. So, but what we've also done is to commit to a permanent wage boost for PSWs at $5 an hour. We've been talking about that right from the pandemic, from the get-go. And this is just the beginning of fair compensation in long-term care sectors, because we also know that there's a team that takes the approach to look after our residents. So we should be looking at, RPNs and other long-term staff to review their wages, from dietary to cleaning staff to nursing staff to RPNs. They do it all together, and it needs to work cohesively for it to be a good experience for the residents and families. So, we're going to promote and protect the increased universal wage and benefits and pensions for all personal support workers, and restrict the use of part-time agency staff, because that's something as well that I had heard that, let's say people are, working, PSWs don't just work their 8-hour shift, they're working 10 hours, or they're working through the lunch. And so sometimes, they're burnt out, and they're calling in sick, or they can't make it on weekends. And so they have agency staff when people aren't there. And the agency staff don't have the same, knowledge about the residents, and it becomes harder. So having permanent full-time staff, as well as obviously some flexibility for part-time people, because some people want part-time, right? It's in that calculation, or in that mix. But we need that solid force. That's the full-time, basic workers, the basic care that provide that very important care for our seniors, to be continuity, right? It has to be continuous is one word, but it has to be continuity, where it's the same thing, and the people know each other. And when there's a change in someone's care plan, that worker has been the one that's looked after them.
No, that is very important, very important. And I'm sure that definitely looking at the salary for the staff, for the PSWs, the RPNs, the RNs, that would make a huge difference, because again, that would stop probably the multiple facilities that they need to work at as well, right?
And leaving the system, right? There's been,
Yeah.
this government talks about that there's shortages. Well, there's been a lot of PSWs that leave the system, and graduates who come and they decide, this is not for me. I didn't realize what I was getting myself into. So you've got that as well. So we do need to hear from staff and families and unions and experts and care providers around what that looks like.
Thank you. And I know right now we're recording this on February 26th, and this will be launched in March. So there was an announcement made by the minister earlier this week, and I wanted you to speak to that announcement in regards to the funding for PSW programs and offering free tuition. What do you think in terms of your thoughts as to how that really going to help at this point in time?
Well, I understand where the government is coming from. Education is expensive. So, that's a good initiative to say that the cost of it is going to be bared by the government, and so to attract people to the sector. So that's a step in the right direction. But it's just not about education. It's also, like, as we've been talking about, the working conditions. And you can pay someone's free education, and there's people who have paid for their education, as I mentioned earlier. And once they get there, they say, "My gosh, I can't look after 13 seniors or vulnerable population in 8 hours. It's just not humanly possible." And they get to a breaking point and they leave. So along with those initiatives that the government is taking, I urge them to make this a priority and pass Bill 13 and enshrine that 4.1 hours of care in legislation so that homes have to provide it and they're held accountable. And by doing that, also you're respecting the workers that you're saying, come to the field. We're going to, give you free tuition, we're going to give you the Premier announced a $3 bump for PSWs. But bottom line, you can, I've heard this saying before, you can get paid really well, but if the stress outweighs the wages, it doesn't make happy working conditions. And people will make that tough choice and say, is the money worth all the anguish and the fact that I can't get my work done, and the fact that, I'm not being able to feel satisfied and accomplished of what I came here to do, right?
No, very, very, very true points, because I mean, if your wages cannot even be able to pay for your education, that too is another major factor on top of everything else, right? So I know that last year, I think it was November of 2020, that the Compassionate Care Act, which allows for everybody in the province to have access to palliative care. Now, how would this now be implemented? I know right now they're creating the framework for that, but then how is that going to be decided within long-term care? Because obviously with the palliative care approach, that's going to take a lot more staffing to be able to truly implement that type of approach and availability in long-term care.
You're correct. I mean, palliative care is one of the progressions that we're all going to face as we age, and having palliative care is a good thing, and we need to provide that service. Seniors, there's the population, as we know, it's getting bigger and bigger, and it's coming, right? That tsunami, they call it, that wave is coming of seniors. And what I know from talking to seniors today and people in knowing that they're going to be seniors in so many years or decades, is that they want to stay home longer, as long as they can. So that's part of one of the things we need to pay attention to when we're talking about care and long-term care, is making sure that we respect the wishes of people when they want to be home and be cared for. So palliative care has a role to play in home care. There's also great agencies and facilities that provide that palliative care. In London, we have a wonderful facility that just recently, a few years ago, provides that care. And then, of course, as the other level is long-term care. And I think about that in the context of what we're discussing today, that workers are having trouble just delivering the basic frontline needs of our loved ones. And so when there's a palliative care piece, I mean, how are you going to ask them to do everything, right? How are they prioritizing? Obviously, a palliative care is number one, because, that's a horrible situation where you don't have enough staff. So when the government's talking about that framework, it needs to understand that, palliative care, yes, is important, but we also have to get the foundational care correct, and then provide the level of care that's going to be respectful and dignified to people who are in that palliative situation. Long-term care has been so neglected over decades. And if we're going to get it right, we do have to have investment. It needs to have investment. And we could have done that over the years. It's been underfunded, less than inflation, right? That's always been a problem. And now we're seeing the outcomes of that chaos, not allowing long-term care, which is one of the, again, most vulnerable populations, and workers who do such great work, to be properly funded. And here we are today scrambling, for workers. This could have all been prevented. This all could have been prevented. And that is, to me, I think the most sad part I feel for families that have gone through COVID with these kinds of conditions. We knew those conditions were there. It was just a matter of time before things got worse. COVID brought that to a quicker head, right? So having a Bill 3 passed for palliative care and having that framework, they need to have the training, they need to have the staff who has the time to take that time away from, let's say, if you're dealing with residents, you need to have that comfort level to say, I have to look after this palliative care patient. I know my residents here are going to be looked after because there's enough staff to do that.
Yeah, exactly, because I just don't see how that could be passed and then not for this particular bill as well to kind of provide the additional framework that they need for it. The other thing is right now it's in committee. So for our listeners, what can they be able to do to help push this bill along?
Our Bill 13?
Yeah.
Yeah, I do want to say though, when the government's making a framework for their Bill 3, they need to have money with that framework, right? Ideas and framework is good, but we do need to put the investment into that. So what our listeners can do to help our Bill 13 is, to sign our petitions that we have, to go on your Twitter and tag the minister and say, hey, Minister Fulton, push Teresa Armstrong's Bill 13, time to care. Put that in legislation. You might get a response saying, oh, we have an average of care of 4 hours. It's going to be, phased in 2025. That's not the answer we're looking for. Say we need to legislate it. We need to hold homes accountable so that they actually deliver that care. Because really, again, these are promises that don't hold water, right? We want actions behind what we promise. And that means if we pass Bill 13, we're going to have action for it to be legislated and hold homes accountable. So going on Twitter and, asking for that to be passed, contact your local MPP, ask for a meeting and say, look, and don't accept the answer that they're going to give you an average of 4 hours of care. That's not working. We have an average of 2.7.5 right now. It's not working. That's why we need to make sure it's law. So doing that, attending town halls, I really encourage people now within this virtual Zoom world to, start their own groups in their own communities and give strength in numbers to say, let's push for Bill 13. If hopefully that's the bill you want to see happen to make those changes in long-term care, as we're talking about it now. So that's another way people can gather now,
Perfect. No, and it doesn't matter what the political party is for their local MPP. They can just reach out to either anyone.
Absolutely. And I say that because our MPPs want to hear from people who want to support Bill 13 so that when we have events, we can call on you and say, hey, come on out. Let's pressure that government. Let's make that public pressure because that's what they respond to, right? A lot of the public pressure we've been putting on them in the legislature through legislation, they have come in small steps.
So it is still very, very effective. So which is good to hear. And do you have any final thoughts, MPP Armstrong, just to provide our listeners at this time?
Yeah, I just, I really want to encourage everyone out there to look at our ONDP platform for seniors care. It has a whole new vision for what seniors care should look like because we spoke to the people that are receiving that care and families firsthand who have loved ones in care. And we've also spoken to people working in long-term care and experts. And I'm really proud of that seniors care plan because it envisions seniors care differently. It envisions seniors care, long-term care homes to be a home, smaller homes with staff that can give that care hours of care, culturally appropriate care, which we know we have a diverse population, and the way we're going to invest in home care as well, because as I said earlier, home care is a part of long-term care, and so we're looking at both of those aspects, and we're really conscious of making sure the workforce is there and that they're paid properly, they have the resources to provide that care. Because when in the future, as we said, seniors in the next 15 to 20 years are going to be one of the highest populations. And if we don't invest now, we're going to be paying in ways that are incomprehensible, like we saw with the Canadian Armed Forces report. We don't want those things to be repeated. So I just urge everyone to, when there's the election coming up, to please look at those platforms for this specific file. It's so important to look after that generation, and all generations, don't get me wrong, but we've been far neglected this file for far too long, and we've seen what's been going on, and people rightfully are outraged. So let's carry those passion motions and take action and make sure we hold governments accountable to delivering the right platforms and the right plans for our seniors.
Thank you so much.
Thank you for having me.
You're welcome.
Stay safe, everyone.